So actually I would say there are various elements that are really important. I think that a very sound understanding of what health systems are and how they work at an early stage in a nurse's education is very important, so that nurses in the everyday are seeing how their practice has an impact on health policy. But then when it comes specifically to the research, I think it's really important for nurses to understand policy windows, understand how to frame and reframe their research vis-a-vis the actual policy challenges of the day. And for that, not only do they need to know how to frame and reframe, but they also need to be in the conversation. And so I wish all nurses more confidence at stepping into the conversations of health policy. Yeah, so I was thinking about this question, and actually, I think that we have several good examples, but one that comes to mind to me now is actually what Ireland did. To understand whether they were going to increase the number of advanced practice nurses, the Ministry of Health or the Department of Health connected through the government chief nurse with the University of Dublin, I believe it was, to evaluate the impact of advanced nurse practitioners. And it was absolutely, it's a very good example of where government pairs up with a research institution, but also an example of how nursing research was looking at evaluating impact for policy, not just what nurses can do, but actually what was the impact on cost, on patient admissions, readmissions, and quality of care. And with a very clear framework and that partnership between government and research, they changed the policy to increase the percentage of advanced practice nurses in the country. So I don't like answering this as a transformation, because actually I think it's what nurses have been doing for hundreds of years. But nurses have been tailoring, connecting, expanding, and securing patient care for centuries. They've been system solvers, they've been problem solvers. But the transformation that needs to happen amongst our nursing profession is that they recognize their identity in that, and just how valuable that kind of work is for health policy. And the second piece of that is not to undervalue the work that we do in care. And just as we approach the health challenges of the future with the new digital technologies, with increased migration and mobility across countries, human relationships are going to be essential to anchor those things, and that our elderly are cared for. And I wish that nurses actually would assume that identity as valuable, and researchers really evaluate the impact of that on our patients and our health systems. So I like to see nurses as the hands, the eyes, the ears, and the hearts of our health systems, not just the backbone. But I like to go broader, because I think that in their position at the front line, and with the lens that they take on patient care as being not just the physical needs, but the mental and the social needs, This lens allows them to see these challenges coming, the mental health challenges, the climate change challenges coming, the needs for moving our patients into community care. So they're not only the health professional that can help detect the needs of our patients, but they can also design the solutions. They can research the solutions, they can analyze the impact, and they can also be policy leaders and bring that lens into the policy space for the conversations to take place, so that we don't just see these challenges coming better and that we're better prepared, but that our solutions are also better prepared to respond to these challenges.